a nurse at the infectious disease unit, Kenyatta National Hospital, where the two were receiving their treatment. And Francisca, the first question is, there's so much that has been said about Brenda and Brian, and while we may not dwell so much on what has been said out there, at the very top is the notion that the story of their recovery is hogwash. Is it?
Their recovery is real. Their recovery is real because Brenda came when she was sick, she was tested, and after results were out, she came on 11th. On 12th night, the results were out, but announced on 13th at daytime. So
Francisca, take us slowly. Brenda said she took a ride to Mbagathi. Did she take herself to Mbagathi? Because there are people are saying they saw an ambulance in Rongai where I think she lives. So how did the chronology of events, just take us through. Did you admit her, and at what point did she come, or at what point did you pick her?
Thank you, Dennis, for the question. Brenda brought herself to Mbagathi Hospital, Kenyatta IDU branch. She came in the afternoon, and she came by public means, where she presented herself, she was examined, and the moment she said she had traveled from the US and suspected herself to have coronavirus, she was immediately given a mask, a surgical mask, after which she was tested and then admitted to the isolation ward for further treatment and isolation to prevent spreading the disease. So on that day, after admission, later on the results were out, and the fact that people are saying they saw the ambulance at their home is because after admission and confirmation that she was positive, they had to go and fumigate her house, and that is the ambulance that people saw. So it was not that Brenda was picked from her home. She presented herself to the unit herself.
So at what time on that date did she present herself, and at what point did you first meet her?
She presented herself in the afternoon of 11th, but I met her at around 5 when she was being admitted in the unit, and I stayed with her throughout until now the test came out.
So what process did she go through? Because we later came to learn that she's patient 1. So we never had any other case before then. Am I correct?
You are right, Dennis, because we had admitted several patients in the unit, but most of them turned negative, except this one time that Brenda turned positive. So
she brought herself. Were you dressed up? Were the people around her dressed up? Did you get to find out the people? Because you said she used public means. Was it a taxi? Did she come in a matatu?
She boarded a bus from Rongao Sacco bus, and that is what brought her. So on arrival, of course, we had to receive her as a suspect, and we had to dress up and to protect ourselves from the infection.
So you're saying on the 11th, on the afternoon, she brought herself to the hospital. Yes. And then you isolated her immediately after running the tests?
Yes, the tests were run on admission. Immediately she came. When she talked about the symptoms and the history of having traveled from the United States, she had to undergo the test.
Did you get to find out did you get to follow up on that bus and the people that were traveling in that bus with her as part of the contact list that you were getting from her?
The authorities, usually when you test positive, the authorities will now do the surveillance and follow up the other people who came into contact with her. Example, Brenda, when she came, she gave the contacts. After she tested positive, all the contacts were collected and brought to Mbagathi for isolation and for testing. So after they were tested, some turned negative and went away, and that is where also the number 2 patient came in, and that is Brian. So the contacts were followed.
So Brian came in how many days later after Brenda had presented herself at Mbagathi?
She came on the 13th, the day the results were announced, and that is when he also tested positive and was brought over to the unit.
Okay, there are those who are saying that, there are those who are actually saying that inconsistencies, because She at one point says that she never received reports that she was positive. She only got to hear about it through the media. Is that true?
I want to believe it is true because she had it through the media. The way she says, when the government announced about the first #1 patient, and actually it was her. So she had it through the media.
Okay, so you connected Brenda and Brian. So Brian got the infection through Brenda. Where exactly did this happen? Was it in a party somewhere in their house? Where exactly did this happen? Did you get that information?
When Brenda jetted in the country, they had a get-together in their house in Rongai. So Brian, being a friend to their family, they joined them in that go-together party, a welcoming in party, and that is where Brian got the virus.
So you carried out tests to all the other contacts and they turned negative?
Yes, they did.
How is that possible? Because there are those who will argue that you come into contact with anyone who is positive, you definitely are going to be positive. So how is it that Brenda and Brian ended up becoming positive and everyone else turned negative?
I do not really want to talk much about that, but I would rather say that our bodies, we react differently to sicknesses. So some people may get it, or some people may not. An example, when somebody have a common cold, and you stay in a family, one of the family members can contract it and others not. The same way it happened to Brenda and the friends. One turned positive, others turned negative. So it's just our body mechanism that works on that. Not.
All right, take us through the process. You are handling Brenda, you are handling Brian, and I believe you are also handling other patients. How is it for you when you're handling these patients?
It is a bit challenging, owing to the fact that it's a new virus and everybody is a bit scared. Not really a bit scared, but everybody is scared. And so when they hear about coronavirus in Kenyatta, they hear about coronavirus in Mbagathi, people tend to stay away. And so it is quite challenging for us to manage the patients, but we gather courage because we have gone through the education system and especially the infectious diseases. So we are comfortable with them, but it's a challenge.
So when you're looking at these patients, and let me take you back to the case of Brenda and Brian, because those are the only two that we publicly know. There was another patient that Brenda mentioned when she was flying in from the US through London, that there's a patient she contacted, and this patient also went through these tests. Was she the one who infected Brenda, the patient she was sitting next to in the flight?
Brenda says she sat next to a patient who was really coughing on the plane, and she suspects maybe she got it there, if not in London. So we suspect maybe it's the patient who infected her, but we cannot prove that.
Okay, so yesterday they came out publicly, and we all now know that they turned negative, they've recovered. So at what point did you do the tests to verify that now they're negative after being positive?
Brenda having been admitted on the 11th, and the test came out on 13th. The second test was done after 1 week, and it was positive. So they ran another test after 7 days, which turned negative. After 48 hours, it was repeated, and it turned negative, and that is when she was declared free from the virus.
So did both of them get the tests the same day, because both of them were presented as the two patients who have recovered? So did it happen all at the same time?
Yes, that is true. It happened at the same time.
Okay, so then what kind of treatment were they given?
Dennis, as you know, virus has no treatment, but we treat symptomatically. If you present with a headache, we'll give you something to relieve your headache. Example, we give Panadol for that. If you have a cough, we'll suppress your cough. And if you have a fever, we'll definitely give you something for the fever. But there is no particular treatment for COVID virus.
So these patients are at KNH. Just explain to us, from Mbagathi to KNH, what's the connection?
Initially, IDU Kenyatta was the main isolation. But since the government realized that we might be having a large number of patients, they decided to extend the IDU to Mbagathi Hospital, and that is how Mbagathi and Kenyatta is connected. So we have a bigger unit in Mbagathi that can accommodate over 100 patients, and the smaller isolation in Kenyatta that only accommodates 11 patients.
So in what you're treating, you said you're treating only the symptoms. Is it the same treatment for everyone who's being admitted?
Yeah, it's true. It's the same treatment for all patients, but it's not automatically you have to give them that. What happens, if you present with the symptoms, that is when you get the treatment. But if you don't present, then we don't give you anything. We simply observe you and take your observations like temperature, so that we can see whether you are improving. Are you getting more infections by getting high fevers?
Francisca, you are on the front line as a soldier fighting COVID-19. How is this changing you, or how has it even changed your routines, and when you're going back home for you as a nurse?
That is quite interesting, because this is a new virus in the market and everybody is scared about us. When you tell somebody I'm working at Kenyatta National Hospital and IDU to be specific, they are like, they don't even want to move near you. So it has really changed our lives in that whenever we move, it's like you are walking with the virus in you. And so people tend to stay apart. But through educating people that we are protected when we go to nurse the patients, we are gowned. We don't just go with our home clothes. So people should not be scared to approach us or even move closer to us. Though we are supposed to keep the social distance, but they should not run away from us. Back home, my family is comfortable with me after talking to them and telling them about how the virus is transmitted. I've told them sanitizing, about washing hands. Mm-hmm. And so things are okay, as much as it's hard, but we cope.
This week, a clinical officer tested positive to coronavirus, making him the first medical officer to contract the disease. Are you afraid?
Personally, I'm not afraid, because I am well protected by the government. The government has provided me with enough PPEs. I have the gowns, I have the goggles, I have the mask, I have the gloves. So whenever I go to take care of my patients, I'm dressed. When I leave the place, I remove I degown. We call it degowning, removing out the PPEs I'm wearing. So when I move out of that place, I feel a little bit safe. Not really a little bit, but I feel safe. After that, I wash my hands. I have a bathroom, I'll wash myself and move out as a clean person. So I'm not worried. And I'm sure even my other colleagues are not worried about that.
Well, my last question will be very quickly. The Kenya Union of Clinical Officers have been complaining, and others, that the workers are being deployed and the government wants to hire more health workers on the front line to fight this virus, but they have no training and protective gear, and therefore they feel very exposed. Were you trained on how to handle this virus before you started getting the numbers in hospital? Immediately
the virus was announced, we had some formal of training in our hospital. So they arranged and we went through a 3-day seminar. At least a larger number of us have gone through that. And I'm sure the government is looking into that and will train as many health workers as possible so that they don't contract the disease.
Well, very many thanks. You're on the front line fighting this, and we're all proud of you, and we are all proud of our health workers who are trying to fight this COVID-19, and hope for the best and be safe. We've been talking to Francisca Akinyi, who is a nurse at the Infectious Disease Unit at Kenyatta National Hospital, where Brenda IV Cherotich and Brian Orindi were receiving treatment, and many others are continuing to receive their treatment. At that point, we